Tooth decay or dental caries is a chemical erosion on the tooth enamel caused by bacteria that gradually expands until it causes irreversible damage, such as teeth rotting and breaking, and even tooth loss. Although there are many methods to prevent dental cavities and different treatments to remove and reverse tooth decay, it is currently estimated that more than 90% of the world's population has cavities. Constant acid attack demineralizes tooth enamel, weakening it and leaving it prone to bacterial infection. Bacteria produce these acids from sugars ingested by the patient, so people who consume sweets frequently are more likely to develop tooth decay. If in addition to a diet rich in sugars, people do not follow an appropriate oral hygiene routine, the risk of developing early tooth decay increases as bacteria manage to accumulate in the mouth and cause severe effects. The cause of tooth decay can be one or several of these factors: poor oral hygiene, accumulation of bacteria, a diet rich in sugars, frequent consumption of snacks, and weakened tooth enamel. Dental caries are classified according to where they appear. Coronal caries. It is the most common and occurs in the crown of the tooth, specifically on the masticatory surface. Fissure caries occurs in the natural grooves and fissures of the teeth, areas in which bacteria can accumulate more easily. It is very common in kids, and it is usually reversible by using a sealant for teeth. Interdental caries. This occurs at the point of contact between teeth. It is quite common since this area is difficult to access when performing oral hygiene. It's hard to notice until it happens in a highly visible area. Root caries. This occurs in the root of the tooth. Root caries advance faster because in this area there is no tooth enamel. Cervical caries. Occurs in the neck of the tooth, just where the root and crown meet, and it's also known as gum line cavity, just like root caries. This advances at great speed since it attacks a weaker area. Secondary or recurrent caries. Occurs in areas close to where a cavity has already occurred or even under a cavity filling. Incipient dental caries. Our initial dental caries, enamel presents a small cavity that's hard to see by the naked eye. But even so, the cavity is active and should be treated as soon as possible. Incipient cavities are very difficult to detect because they simply manifest as a white spot on the enamel that only a dentist can notice during a checkup. Rampant caries is an aggressive type of tooth decay where 10 or more teeth are affected. It is also known as nursing bottle tooth decay since it's very common in babies and kids who drink formula or milk and don't get their mouth properly cleaned before sleep. Yet rampant caries can appear at any age. Rampant caries is very aggressive, progresses rapidly, and often causes the loss or fracture of teeth, so the treatment has to be quick and aggressive too. Surprisingly, caries does not cause any kind of discomfort in its beginnings. This is because the tooth enamel is not innervated, so no pain is perceived. However, as tooth enamel weakens, caries get closer to the dentin, the next layer of the tooth that is much softer than enamel. And although it is not innervated either, it has tubules that allow the passage of stimuli to the dental pulp. The dental pulp is where the dental nerves are located and the stimuli are perceived. So once caries has reached the dentine, the symptoms of caries are constant toothache, pain when biting, pain when ingesting hot or cold sugary drinks, tooth sensitivity, bad breath. Sometimes it is possible to see holes in the teeth, and although caries color is white, it can sometimes look like a brown or black hole in the teeth. Cavity treatment varies according to how severe is dental decay. In mild tooth decay cases, it is enough for the dentist to apply fluoride treatment for teeth to reverse tooth decay by remineralizing cavities. But the truth is that very few cavities are discovered at this early stage. Most cases require getting a tooth cavity filling. In this case, the dentist removes the carious dental tissue and then rebuilds the tooth with composite resin until getting it back to its original shape. There are chances of experiencing a filtered cavity after a tooth filling. It occurs when the material used to restore the tooth after a cavity removal does not adhere perfectly to the natural enamel, allowing the passage or filtration of saliva, food residues, and later bacteria that can cause the failure of the cavity treatment. In severe tooth decay cases where cavities have caused deep damage to the dentin and pulp, an endodontic treatment or root canal treatment will likely be required. This consists of removing the dental pulp and filling the space with sterile materials to later reconstruct the dentin and enamel. In this way, the natural tooth can be saved. If endodontic treatment fails, the only option left is the decayed tooth extraction. On the other hand, tooth decay on wisdom teeth is quite common due to the difficulty of reaching this area during the oral hygiene routine, which facilitates plaque accumulation and therefore dental decay formation. Different from other teeth, when it comes to third molars, the suggested treatment is the decayed wisdom tooth extraction, since performing a cavity filling won't be effective in the long term. If you have ever wondered how to get rid of cavities naturally, we must clarify that no natural remedy for dental decay is effective. The only way to get rid of cavities is with the help of a dentist, The sooner you visit one, the better it will be for your oral health. Natural remedies will only waste valuable time allowing tooth decay to spread further and cause more damage. Toothache from a cavity can be terrible and negatively impact daily life. So, even when the best option is to visit a dentist as soon as possible, taking over-the-counter medication can provide temporary cavity pain relief or even stop cavity pain. Painkillers such as ibuprofen, acetaminophen, or naproxen are highly effective in relieving tooth decay pain. Just keep in mind that this is a temporary solution, and you still need to see your dentist. The average cost of a composite filling without insurance goes between $200 and $500 per tooth, while amalgam fillings cost from $50 to $150 per tooth. Porcelain and gold fillings are way more expensive, with prices going around $1.20 per tooth. Insurance companies will cover the majority of the cost, and in some cases, they could cover the entire treatment. This is it for today's video. Thanks for watching, like, and subscribe for future oral health videos. Till the next time.